Hello, thanks for joining me on this journey of the A to Z to CBD. Back to the essential guide to CBD. We're on letter E, and we have epilepsy. This is really fascinating to me. There's been a lot of studies, a lot of information with epilepsy because, it's going on forever. It's not a new disorder. Epilepsy is a central nervous system, which is neurological disorder, in which your brain circuitry and activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Not all that have seizures have epilepsy, though. So there's like 1 in 400 people get seizures, and they never find out the etiology or where it came from or why the person had it. So sometimes you just get them. So in 2018, the FDA approved and currently is still the only approved CBD-based drug. It's EPILEPSY. It's interesting because it's funny they call alternative medicine alternative when actually most medicines are based off of some plant-based healing remedy in nature. So it's actually that the pharmaceutical is alternative and the one from nature would be natural, whereas the pharmaceutical is it's a synthetic version of what's in nature. So it's very fascinating. So this drug that was approved in 2018, it has a high cost to it. It's estimated to cost anyone $32,500 a year or $2,700 a month. It has only been approved for 2 forms of epilepsy. This seems like a new concept, but it's actually not. In the U.S. Pharmacopoeia lists cannabis tincture as a treatment for seizures and childhood convulsions back in the mid-1800s. So CBD for seizures and epilepsy this is from the 1800s. This is pretty fascinating. 40 years ago, scientists first noted that CBD in particular shows promise as an anti-epileptic drug remedy. A study in 1980 showed that half of the volunteers showed dramatic improvement and remained almost free from convulsive attacks throughout the study. That's pretty impressive. So, but then what happened? There was not much follow-up to that study. So I wonder why. Follow the money. In California and Colorado, because they became more lenient with their CBD and marijuana policies, they discovered profound and anti-seizure properties of CBD. Stories of CBD seemingly miraculous curative powers for epileptic children were broadcast on national TV, setting the stage for FDA approval for pharmaceutical companies 5 years later. So EPILEPSY is a big step forward. However, in addition to the huge cost, it contains additives such as ethanol and sucralose, whereas the one in nature does not. As long as you know the quality of the tincture you're using. Like, you must know, because this is not a regulated industry. I could whip up, just put olive oil in bottles and label it with CBD and sell it because it's not regulated. So you really don't know what you're getting. So so people say sometimes, oh, I've tried CBD, it didn't work for me. So first I'd question the quality. And second, I'd question the consistency. How long did you use it? Were you consistent? 2018, a meta-analysis done by Brazilian scientists examined 11 different studies. 670 people took CBD for epilepsy for an average of 6 months. People using CBD, the comparisons are pretty amazing. 70% of them improved with the number of seizures decreased by half, and only 40% had improvement with the pharmaceutical line. 1 out of 10 became seizure-free with fewer side effects, and it was a large number of the clients and the patients in this study that had side effects with the pharmaceutical, and it was fatigue, nausea, GI problems, and 73% of them. That's a lot of people. It's pretty fascinating. So the average dose, let's go to people taking whole plant CBD also had fewer side effects. The difference may be due to lower dose of, okay, so the difference they think of why there was less side effects is because there's additives to the pharmaceutical, which there isn't. So that could be a factor. So in addition to the high cost, you're going to have these extra additives which you can respond to. So it's really worth looking into CBD. There's so many things. Remember, quality of the product is most important, and being consistent and taking it every day, and maybe more. Everyone needs to start at their own dose. You start out slower with a lower dose, and you use that for a few days. If that's, you don't feel much effect, you either increase it or decrease it based on where you are. Some people need a lot, and some people need a little. My husband needs half of what I need, and he's at least 100 pounds more than I do. So it's worth looking into it. Love to help you if you have any questions. Thanks for joining me on this journey. I will check back with you soon.